think about a decubitus. If you haven't seen it, I don't want to ruin food for you. Okay, think about a hole the size of a softball, and it's raw, and it's bleedy. Okay, it's got bleeding, it's kind of bloody in there, right? But it's raw, all right? And what your job is your job is to keep promoting tissue growth, right? So you go in with your squeezed out wet 4x4 that is spread out as big as you can get it because you want all those holes exposed. You're gonna pack it into the tissue inside of that wound because in 24 hours from now, you're gonna peel that off. If I peel that off 24 hours from now, it will be dry and it's on a bleeding wound. I peel that off a bleeding wound, what's it gonna do? It's gonna make it worse, it's gonna make it bleed. But you know what it's also doing? It's keeping it from scarring over. Because if that hole, the size of a baseball or the size of an apple, scars over deep in that hole, it's done healing. And now your patient has a big hole in their side that's not going to get better. So what they'll do with abdominal wounds, gunshot wounds that heal like that, heels, like people's heels get real spongy and then they get rotten. If they heal like that, they take them back to surgery, and these surgery girls know, they take a wire brush and they completely destroy it, the tissue. They rough it all up, and then we start wet to dry packing again. So it's really important that you don't just pack in chunks of 4x4. You've got to open it up, spread it open. So I guess how I want to explain this, when you guys open your 4x4s tomorrow, and I'll show you today, imagine if you fell out in the parking lot and you scraped your knee really bad, right? And you come in and we washed it, and then I took a wet 4x4 and I spread it all out, so all the little holes in the 4x4 were big, and I laid it on your knee, and I said, tomorrow when it's dry, we're gonna rip it off again. That's debriding, and that's what we're doing. We're debriding it. Now, do we wanna do that to your skin? No, because you don't have a hole right in your knee, right? But if you had a hole that we were trying to fill, we would keep debriding it and ripping that off, and bleeding is good. You want it to bleed every time you do it. And so if you're taking care of a long-term care resident and every time you do this, they seem to be bleeding less and less every time, then you're not doing it right. They should be bleeding and bleeding until you get to where it has granulated in. It's gonna look like little white flakes in there, little white grainy grains of sand, and that is new tissue growth. And it grains in and it grows higher and higher to the surface, and then pretty soon it's level with the surface. And then you don't have to rough it up anymore, you just let it scar over. Does that make sense? So that's why we're doing this type of a dressing change. So we're gonna unpack it, then we're gonna measure it, then we're gonna irrigate it, and then we're gonna culture it. So I have people that go, why would you culture it after you've washed all the bacteria out of it? If it's truly infected, you can't wash the bacteria out. It lives there, it lives deep in the wound. That's where you will culture it, is deep in the wound. You irrigate it first to get all the debris out. The sluffy skin, the blood, all the junk that's in the wound, get rid of that, get it out of the way, and then you culture deep in the wound. Make sense? Okay, so remember that. Then we're gonna pack it again wet to dry. When we pack it wet to dry, we don't want it stopping wet because we want it dry tomorrow. And it's gonna be in a warm, moist environment, so we want it to be squeezed out enough that it will be dry tomorrow. So not stopping, not dripping. And then we pack it, and then we redress it, and then we document our findings. So the findings are, I took off my dressing, it was 1/4 saturated with serous sanguinus, non-odorous, what have you, right? And then we go to measuring it, and I measure it always in centimeters, and I want the length of it, the width of it, and the depth of it. And if we look at that every day, we'll know if it's improving. And you always go to the deepest depth. So you find the deepest point in it, and that's what you measure for depth. And then we would say we irrigated the wound with normal saline, and then we obtained our culture, and then we packed our wound. And when we pack the wound, if you have any tunneling, so tunneling, sometimes these wounds just go, and it looks like a tunnel, and it's way back in there. Do you see a tunnel? You take your Q-tip and you pack that packing way back in there. And usually, these people don't have feeling because their nerve endings are already ate up in that spot, so you're not really hurting them, in most cases. I would medicate them for pain ahead of time for discomfort, but they're not gonna be like, it's not like poking you in the gut without a prior problem. Then we redress, which is just putting our 4x4 or our ABD on, and then go from there.
So all gauze that goes into the wound is wet?
Everything that
Except
goes in
for
the
the
wound is wet
ABD.
except for the ABD. Yep, and it's all accounted for. So if I put 3 of them in there, I have to document I use 3 of them. Yep, very good. Okay, so the first thing I'm gonna do is I'm going to take my dressing off. I'm glad you brought the tiny gloves.
I know. I like it, struggle a little bit.
Claustrophobic. So I have all my supplies. Everything's here. And when you take a dressing off of a patient, you always want to, so we'll say their head's up here. We have a little marker. Here's your brain. Here's your, yeah, the brain. There's your brain there. And there's your pigtails.
Yeah, we can't see.
You can't see. Oh, I'll fix it. Can't see.
Yeah.
Wait till she gets. So there's her little head. So I'm gonna call her Sally. Sally, I'm gonna take this dressing off of you and replace it with a fresh one. Has it been bothering you? The tape's been okay? It hasn't been hurting you?
Yes, it hurts really bad. It's irritating.
Cover that little thing up. Cover up that little tail. It hurts really bad?
Yes.
Well, okay, I'm gonna have Marina go get you some pain medication.
Okay.
Marina's gonna get you
I'm
some.
gonna go get her morphine.
Oh, she's getting her the good stuff. She just has Tylenol ordered.
Well, Sally needs morphine today.
So, because her head is up here, I take off the dressing so that I can see it. I don't necessarily want her to see it, right? Because some people like to look and see, and if she wants to see and she looks at it every day, great for her. But if I don't know how she's gonna handle it, I take it off so she can't see it. Oh, also, don't pay attention to this one. This is the one we're changing. This thing's just riddled with wounds. Someday you'll get to see what's under here. So I look at this.
Skills.
Everything. So this right here, I'm gonna say that it's quarter saturated with some serous sanguinis, and I don't smell anything that, smells like infection or anything like that. And then I'm gonna fold it up and I'm gonna put it in the trash can. And I actually am just gonna do this. I'm gonna put it right inside my glove.
Okay.
Done. Okay, now what I need to do.
Oh, you want?
None. Of course, you always wash your hands before you start doing this stuff. Always. Always wash your hands. Oh my gosh. Here.
I know.
Oh, I kind of like that better.
Okay.
Okay, so now I'm going to take these out. And I read my notes and I know that I put 2 in yesterday. So I'm going to just take it off the top here. I'm going to start pulling it. And I just wrap it up in my gloved hand. Okay. There's one. There should just be one more in here. Okay. And we'll say that it's bleeding some. I'm going to take my glove off, put that dressing inside, and I'm going to describe what I seen on that as well, and that I had 2 of them. Okay. Thank you kindly. So now what I want to do is I'm going to change my gloves again, because wounds are just kind of, they're just kind of icky. So you're going to be changing gloves a lot. You don't want to be running around with dirty gloves, touching stuff with dirty gloves. And I knew I was going to have to touch my Q-tips. And so I'm going to start right here. And I'm going to say it's probably whitest here. And I'm going to go, we are 4.5 centimeters. She's writing that down for me. By 4 centimeters. And then I'm going to get one of these little sterile Q-tips out of here. Okay. And my deepest spot is probably right here. So I'm going to put that in the deepest spot, and I'm going to put my fingers down to the top of it. So that's how deep it is. And that is 2 centimeters deep. Make sense? Okay, and then this goes in the trash, and this goes in the trash because I've been measuring with it and I could have got some ink on it.
In our world, sterile. That's right. Magic sterilization. She's sterilized.
So I changed my gloves. Okay, so I've undressed, counted, measured. What's my next step?
Irrigate.
I'm gonna irrigate, right. So to irrigate my wound, I have a couple options. If it's a big wound on somebody's side, I would probably have them roll a little bit to the side, and you wanna irrigate with some pressure. You start at the top of the wound, and you go back and forth, back and forth, back and forth with pretty good pressure. If you just kinda get it wet and it drizzles off, is that gonna knock all the chunks and exudate and all that stuff out of there? No. So don't be a weenie about it. But we have this nice little setup right here, your irrigation tray. So we're gonna open our irrigation tray. And it is sterile. So it's open. And we're gonna treat the inside of it sterile and the outside of it clean. So I'm gonna try, can I go out any further? Nope, I don't think so. Okay, so there's that. And then I've got this little pan right here that I'm gonna go ahead and peel the rest of this label off of, because I need to use this little pan. First, in here is an alcohol wipe, that's handy. There's this little tip, and this little tip is what will actually go on the tip of this if I needed it to. The tip of this if I needed it to, but I don't need it to. It's just gonna go off the side. This little towel, I don't really need a sterile work surface. I need something that's not gonna get my patient all wet and your bed all wet. So you pick up your patient, got a little slab of meat, and you lay them right here. So what I'm gonna use this for is to irrigate into, okay? So now, I've got my sterile, so the inside of this is sterile. So when I pick this up, I can hang on here, but I cannot hang on below here. All right? So remember that. I can hang on to this part, I can hang on to this part. I cannot put my hand on this part because then it's no longer sterile. Everything inside of this container will be sterile. I'm gonna pour my sterile saline in. Where does my hand go on this bottle?
Covering the label goes in.
Covering the label, right? Right over the label. So that when I pour, I'm pouring away from the label, so I protect the label from getting drizzle down it. Alright. So now, I open this up, and I put my lid up, right? So it's faced up. I pull this out, I pour as much as I want. I put that back in there. I can touch here, but not below that little wing. Okay, so the solution inside of there is sterile. We're gonna save this because we're in long-term care and we're gonna use it for 2 different dressing changes. If that's the case, what do I have to do to this bottle I just opened? Date it, time it. Yes, date it, time it, and initial it, just like I will my dressing. If I'm probably in the hospital setting where money flows like water, then we throw this in the trash, okay? All right, so we've got this, we've got this. We got our little wet pad underneath. Okay, so I'm gonna tell my little patient, would you lay on your side for me, Sally, is that what we call them?
Yes, I'll try my best.
Would you just kind of lay over top of that drain?
Lay over top of
Yes.
that drain.
So now I'm gonna draw up,
What's your order say?
my order says irrigate until clear.
How much?
It doesn't say how much, it says irrigate with normal saline until clear.
Okay.
That's what my order says. She
Okay.
asked.
Perfect.
I make it up as I go. Also, what you don't wanna do is you don't wanna be touching this part, because this part goes into the part that holds the sterile stuff. So I can hold here, and I can, it's just so hard to see.
Drive there.
And I can drive here. Okay, so I'm gonna get this wound, and I'm gonna
Is
start.
this gonna hurt?
It shouldn't hurt, but you might feel a little bit of moisture,
Okay.
and it's room temperature.
Okay.
Might feel a little cool.
Okay.
You're gonna be just fine. I'm using a little bit of pressure. Start at the top, work my way down, and it's plastic, so she's gonna probably not really absorb like a mortar shield. Okay, now, we're gonna go up here. I have a little tunnel up here, I'm gonna spray again.
Okay. Oh, whoa.
I'm trying to use pressure. Don't tell IT.
We wonder why our things don't work.
Pressure blaster. Okay, so I pressurized it, and it's running clear now. I got all the chunks and kind of most of the blood out before, now I'm just getting the clear stuff. So I'm done with that. I can put that over here. Out of the way. Okay, and then they won't just hold water because most people are not plastic.
Right.
But if they were, you would just dump it. Oh, don't put that thing. Cover that thing up. Okay, so now I've irrigated, and I'm gonna change my gloves. Her wound is right next to her little,
Huh? I don't know.
right next to her little part.
That was a Foley catheter also skill.
It could be. It's the suppository in that
Suppository. Yeah. That's what
Okay.
we've hidden for you.
So after we've irrigated, what's our next job? We're gonna get a culture. So, got a culturette. This really confuses some people. I'm gonna try and put it where you can see it here. Right. Okay, I'm gonna open it. Everything inside there is sterile. My hands are clean. I'm using sterile technique with clean gloves. Got it? So, all I'm gonna touch is the tip of this, because I want to keep this sterile, and this I can pull out. You have to take off the cap, take off that lid right there. People forget to do it and they're jamming it on the lid. You gotta take the lid off. Take the lid off. You know how many you're gonna do that tomorrow? Okay, so I have some tunneling, so I'm gonna go back in that tunnel, and I'm gonna twist it. I don't know if you can see me twisting it. And I'm gonna twist it around the bed of that wound. If I see pus, I'm gonna just drag right through it and twist right through it. If I see something that looks suspicious, I'm gonna stick it in it and twist it. I mean, if it looks gross, get it, because that's what you're after, right? Get all the gross stuff. Then, you take this, you stick it in here after you've taken the lid off, all the way through. You sink it as deep as you can until it's tight. And then down here, there's a fixative in here. And you squish that, and that fixative and that little cotton ball on the end right there, it seals that sample right now. It doesn't let it keep growing, it doesn't let it rot, it doesn't let it change, it just stops it in time. It's a fixative. So now, if I don't send this down for 2 hours, they don't look at it for 6 hours, it's gonna be exactly what it was right now at 3 p.m. Make sense? And what do you gotta do with this before you take it?
Time, date, initials.
Time, date, initials, where it was obtained from, because think of all the cultures. Cultures can come from anywhere, right? This one came from the, whatever the wound is. The wound just adjacent to the, yeah.
Coccyx, maybe?
A coccyx wound. It's a coccyx wound, and we have it here. And then we have to put this, before we leave the room, what does this go into? Biohazard bag. Can I run down the hallway waving this in the air on the way to the tube system? Absolutely not. Not only is that bad manners, that's gross.
Okay.
Okay, so now, what is my next job? For my next act,
Right?
we're gonna pack that guy. All right, so I am gonna take my gloves off, and I'm gonna take my sterile gloves, right here. And I always use my sterile glove wrapper as my sterile field, okay? So I'm gonna scoot her clear of what.
Do you know what this? No.
Ah,
Where are you
probably.
gonna?
Yeah, I think that's okay. So this is my sterile glove package. Thank you for the 7.5, by the way.
You're welcome.
Okay, so I'm gonna take it here. Everything inside of it's still sterile. I am going to do all my setup here. So I grab this, I open this up. You don't want anything sterile to sit within an inch of that edge on these little wrappers, okay? So the whole inch edge now is no longer sterile. Everything in the middle is sterile. I know that I'm gonna need, and I would never reach over my sterile field. I'm just doing this to show you, because that's the only option I got. Don't ever reach over your sterile field. This is my sterile field. I want Q-tips. I want sterile Q-tips. I open them up. I drop them. I want my woven gauze sponges. I open them up, and I drop them. Now tomorrow, if you guys open them up and they drop within an inch, or they drop off of your table, then what would you do? Throw them away and get a new one. Now, because we live in a fairy tale world, you could repack them and ask if you could use them and redump them. Because, you know. Now, I don't have to have my combine pad sterile. It's gonna go on top and I'll be able to open that and place it sterilely with sterile procedure, but it doesn't have to go on my field. Okay, so because I put my 4x4s on top of my glove, I'm going to need my friend to pour me some sterile solution onto my 4x4. Otherwise, if I had placed it more here, if I dropped it more there, it's a little close to the side, but I could have poured my own sterile solution. And I just want a little bit of saline poured on there to moisten it so I can do my wet to dry dressing change, right? Okay, so I've got my packing, I've got my Q-tips, I got my sterile gloves, because I really do want to do this sterile. I don't want to use clean hands and not sterile hands to pack the inside of a wound that I just made bleed, right? Okay, so we're going to put on our sterile gloves. Don't look at that Q-tip, okay? And I guess one thing I am doing, which y'all probably can't see, is I am putting on my sterile gloves off of my field because I can't stand to put them on over it for you. You don't put your gloves on over a sterile field, you don't reach over your sterile field, you protect your sterile field, okay?
Why you screw up?
I know, right? Okay. Okay, so now I have these, and we didn't put a lot of water on them, but there's a lot of saline, but they're still pretty wet. So I'm gonna squeeze them out, lay them over here to the side. And these, we wanna completely spread out. Now what I wanna help you understand is I can't just stuff it in here like this, because these little holes are too close together and they're not gonna grab and tear that tissue out tomorrow like I want it to. What I want for debridement is to open this completely up, as big as I can make it, and as thin as I can make it. And you see how these holes are gripped easier? Keep going back to like, if you scabbed your knee, think how those little things, when it's scabbed overnight and this dressing dried to your knee, what that would do when I tore it off tomorrow, right? I had a nurse at the nursing home one time, this is 15 years ago, and we were doing a dressing change, a wet to dry, and she brought like saline with her to pour into the wound so that it wouldn't make it bleed when she took it out. I said, well, that's kind of the opposite of what you're doing. She goes, oh, but she bleeds. When I pull this off, it bleeds.
That's the point.
That's the point, right? And so people just really don't understand it, because that is the point. It's not just that you're putting a dressing on and you're taking it off and you're putting a dressing on. You have to let it debride, right? So here's our little dressing. It's all spread out. And then what we're going to do is we're going to pack that into that wound. And I have to do this because it's just, my assistant left and I don't know it.
I had a code in the other room.
She left me. Okay, so I take my dressing and I'm going to coil it up in my hand, because if I got it all spread out, then I don't want it dragging across your skin, right? And then I'm going to take my little sterile Q-tips and I kind of press them into the water over here that I had that excess water. And I'll take and I'll push them down into the tunnels and the corners. Now, I will tell you that if you're packing this and you notice that you get like some, this is touching the skin, see how it's laying on the skin? I don't want to pack this into the wound, but at the end I can lay it on top, right? But I'm not going to take that and pack it into the wound. But I'm going to pack these little edges, and sometimes you can use a stick in, and if your gloves are sterile, you could even just use your fingers. Pack it in there. And the point is that you get the most full, like, contact with the wound itself. And like I said, if you have tunnels, you pack it into the tunnels. Okay, so this, And then I'm gonna leave that hanging out because I'm gonna pack one more in there. And then when we're all done, we're gonna take that little piece on the skin and fold it on top. But we're not gonna try and make the contact with the tissue. What do you think? Make sense? I'm gonna cry, are you?
No. Low key, it kind of looks fun.
It is fun. Wound care is fun. We need wound care nurses. Some people cannot stand a wound, and some people love wounds, and we need the wound lovers. I am not really a wound lover, but I do like doing dressing changes. Okay, so I'm gonna go back over here, and I'm gonna help pack it into the corners. Like I said, if I had tunnels, I'd pack it into the tunnels. I want underneath the edges. Okay, so we're all packed in. I'm gonna fold this over. So that's all packed in there and good to go. Now, I have my ABD pad. And we take our ABD pad. We want it to be sterile on the inside of the ABD pad, but the inside is inside of this, okay? So now, I have a black marker. And I'm gonna put over here that it is 9/18/24, and it is 15:05-ish. Is that about what time it is? And I'm gonna put my initials. And then the blue stripe goes on top. The inside goes against the patient, and the inside is sterile. Against the patient. See which wound I was dressing. And then you tape it into place. And we kind of prefer the plastic tape unless they have a tape allergy or they're very sensitive to tape, because this plastic tape stays a lot better, but it also can cause some redness and itching if they have a tape or an adhesive allergy. Otherwise, you just tape this into place. And she's got so much going on here, but you really want to just tape it to where it's going to stay. You might need wider tape.
So you wouldn't like tape it where it's completely sealed on the edges?
Nope, you don't have to completely seal it. They actually have dressings that are occlusive that would completely seal it, but this one we don't want to completely seal it because it would seal that over and it wouldn't dry properly.
Okay.
Yep. Okay, what do you think? How you feel about it?
Good.
Questions? So you guys will do all of that stuff tomorrow. And I have in our lab in North Platte 4 of these stations set up with all the supplies.